Hi guys, welcome to Mom and Baby Wellness. My name is Nasteri and today we are covering your introduction to breastfeeding. So kindly watch till the very end. So moms, if you are just about to begin breastfeeding, this video is for you. It will answer so many questions and help you in situations that you may find yourself in. So let's get started with question number 1. How do you know your child is full? So you've just started breastfeeding and you don't know whether your child is full or not. So there are several things, there are several ways that you can tell if your child is full. One, if you are able to change, if you're able to, like, your baby is wetting or pooping in his or her diapers for at least 6 to 8 times in a day. That I'm talking about a newborn baby, not a baby who is over 6 months old. I'm talking about a newborn baby. That is one way that you can tell that your baby is full. Another way is that your boobs feel full in between feeds and drain or become empty after a feed. That will tell you that your baby has emptied all that milk into itself. So that is another way that you can tell that your baby is full. Another way that you can actually tell that your baby is getting enough breast milk from you is that they are demanding for another feed after a reasonable time frame. That is after 2 or 3 hours after each feed. So if your baby is demanding for breastfeeding maybe after an hour, that should tell you that maybe this child is not getting enough. But if they are only demanding after 2 or 3 hours, then it's a highly likelihood that this child is actually getting full. On to our question number 2. I have about 12 questions, and before I go ahead with all these questions, we have a very awesome breastfeeding class. I will leave a link below this video because it's very informative and it will even guide you in a very in-depth way, because breastfeeding is very personal, and even though it's natural, it's not easy at all. So I encourage you, after listening to and understanding all these questions, go and sign up for that breastfeeding class. There's a link below this video. Question number 2. How long should you breastfeed on one breast? So how long should you breastfeed on one breast? So to answer this question, I want to tell you that there are levels in breast milk has levels. There's level 1 or layers. Layer 1, it's more water. Layer 2, it's more nutrients, proteins, all those things. Level 3 is fats. So you need to be able to exhaust all those layers. And how do you do how long does it take to exhaust all those layers? Because they are very important for your baby's growth. So your baby needs the water, your baby needs all the nutrients, and the baby needs all the fats that are in your breast milk. So to exhaust all these layers in that order, you need to breastfeed on one breast for at least 10 minutes before turning over to the other breast. Question number 3 is breastfeeding painful? For very first time moms, breastfeeding may feel a little bit uncomfortable because that nipple has never been suckled on too hard as the newborns do. You don't think that they don't suckle hard. They suckle very hard, and it may feel a little bit uncomfortable. And some first time moms, if you don't take care of your nipples, a few months to your delivery, you may get sore nipples as a result of this suckling, because it's your first time and the nipples are not hard enough. So yes, it may be pain, it may be uncomfortable, it may be uncomfortable, but if you take care well of your nipples, there are nipple creams to prevent getting sore nipples as a result. Before you get used to it, it should not be painful. It only becomes painful if you're latching if you're not latching properly, and if your nursing on sore or cracked nipples. So you need to avoid getting cracked nipples at all costs. So there is a video that I've done before. I want you to go and check it out after finishing this video. Of course, it's about latching and positioning while you're breastfeeding. I'll also leave the links below this video. Kindly watch those videos and inform yourself. I'll also leave a link below this video on the best nipple creams that you need to be using now and even when you're breastfeeding to prevent cracked nipples and sore nipples at the same time. Question number 4. Will I have enough milk for my baby? So that is a very concerned mom. She's asking whether she'll have enough breast milk for her baby. So the answer is yes. You will have enough breast milk for your child if you eat a balanced diet and take a lot of healthy fluids. Let me call them fluids frequently, and make sure you hydrate really well. There's also a video that I did about how to increase your milk supply. I will leave all these links below this video. Go and check it out. If this is a very big concern for you, it shouldn't end. Kindly watch that video. Question number 5. How long should I breastfeed for? So I'm thinking about, not the length per breastfeeding session, because I've already answered that in question 2. How long should you breastfeed on one breast? So how long should I breastfeed for? I think this varies from country to countries. So from my country, we are encouraged to breastfeed for at least 2 years. 2 years. But in some Western countries, it's a miracle, when a mom is able to breastfeed for a whole year. So I think you should just follow the policies that are placed in your country. But for us, we breastfeed for at least 2 years. It's the recommended, because breastfeeding boosts the immunity of your child. So it's very vital. If you can manage to breastfeed this child even for a longer period of time, the better for your child. Question number 6. When will breast milk come in? So when will breast milk come in? I'm assuming it's after delivery. So when will breast milk come in? So some women even experience, breast milk coming in few days to the delivery, and some immediately after delivery, and some, especially moms who go through CS, breast milk may come in delayed, maybe after 2 or 3 days, but it usually comes in that order: before delivery, after delivery, immediately after delivery, or a few days after delivery. So that's it. Question number 7. Does the size of my breast affect milk production? So the answer is no. The size of your breast does not determine the quantity of breast milk you produce. Actually, the mammary glands are the ones that determine the milk production. So the answer is no. It doesn't matter whether you have big, medium, or small breasts. You can produce enough milk for your child. Question number 8. How can I enhance my low supply? How can I enhance my low supply? As I've told you, I think I've answered this question in another way earlier on. So you can enhance your supply by taking plenty of fluids. Take a lot of water. I even did a blog post about this, how I boosted my own milk supply. I want you to check it out. I'll also leave the link below this video. But taking a lot of water is very important. Take a lot of other healthy fluids. I do not encourage moms to overeat. Eating excessively does not boost your milk production. You only add so much unnecessary weight. But eat a balanced diet. Do not starve yourself at all. So eat a balanced diet and take plenty of fluids. Plenty. By plenty, I mean a lot. I quantified this plenty in this blog post below this video. Kindly go and check it out if you're battling with a low milk supply. Another thing is you need to rest well. You need to rest well. If your baby is, is not the most cooperative ones, you need to get some help with your child so that you can have enough rest. Because when you're not resting enough, your stress hormones are way up there, and this may interfere with your milk production. Another question 9: how do I avoid and soothe engorged breasts? So engorgement comes as a result of, you have so much milk in your breast that you're not draining out, or your baby is not able to drain this milk out, or you're just feeding on one breast for a very short time period, and you're not able to drain all that milk from your breast. One thing, you need to prevent engorged breast, because this can lead to mastitis. Mastitis is a very painful breast condition, and it comes about due to clogged milk ducts. Your milk ducts gets clogged because of this milk that is not being drained. So one preventive measure: make sure that you exhaust one breast per feed. If the baby cannot exhaust that milk, you need to pump it out and store it so that your baby can feed on it later on. So you need to make sure that the breast milk does not fill up and make yourself so uncomfortable that you're not even able to lie down because of the pain. So make sure you drain that milk. If the baby cannot feed on it, then pump it out and store it. Another thing that you need to do, when you're suffering from engorgement, I've told you need to just press it out, or if you don't have a breast milk pump, press it out using your hands, and then apply some hot compresses, some hot water, dip a cloth, and try to massage your breast as you drain that excess milk. So that should deal with engorged breast, because if you stay with this engorged breast for such a long period of time, you may develop mastitis, which is not something that you'd like to experience. Question number 10: how do you cure sore nipples? So how do you cure sore nipples? So I have mentioned a little bit about sore nipples. Sore nipples is whereby when you latch, when your baby latches on your breast, you feel some pain, and breastfeeding should be enjoyable. You should not be like you should not be like fearing to breastfeed because of a sore nipple. So one thing that you need to do is that you need to moisturize your nipples so much well. Moisturize it frequently. After a feed, wipe the breast and apply the nipple cream. There's a link below this video. I suggest you get that nipple cream so that you may avoid this sore nipple. So there are two ways. One, you must latch your baby properly. You must latch the baby properly, and you know that you've latched your baby properly if the baby, that whole dark area, the areola, is inside your baby's mouth completely. So you know that you've latched your baby properly if that happens. And number two, you need to moisturize your nipples frequently. I'm talking to first time moms. Second time moms, they may not get these sore nipples as much as first time moms, speaking from my own experience. So you must moisturize your nipples after every feed. So after the baby feeds, wipe the breast with some warm water, then dry it, then apply the nipple cream. And when the baby comes to breastfeed on the next session, wipe the breast again, breastfeed the baby, and repeat the process until the nipples are hard enough or have hardened enough for you not to get sore or cracked nipples. So I hope I've answered this question. Question number 11: when should I start pumping? I'm assuming that this is for this question was asked maybe by a mom who is working, and she's wondering, when should I start pumping so that when I go back to work, my child has enough milk? So I would say you should start pumping immediately. Start pumping immediately. a point that I've forgotten, if you also need to increase your breast milk supply, because if you're pumping, you need a lot of breast milk, and when you breastfeed your baby, you need to put on that pumping machine and start pumping, because when you breastfeed very frequently or pump very frequently, this stimulates more milk production. So you should start pumping immediately when your breast milk starts coming in. So breastfeed your baby, then pump, or in between the feeds and your breast feel full, then go ahead and pump, then store this milk and wait for the baby to wake up and continue breastfeeding. So pumping frequently or breastfeeding frequently stimulates more milk production, which is good for you and for your baby. Another question: should I stop breastfeeding if I'm sick? Should I stop breastfeeding if I'm sick? I'm going to answer this question from a medic's point of view. So there are some drugs that are excreted through breast milk, just the same way alcohol can be excreted through breast milk. There are some medications that may be excreted through breast milk, and this should be answered by your doctor depending on the condition that you're suffering from. Are the drugs that you're taking, will the drugs that you're taking be excreted through breast milk, and will after your baby sucks on this breast milk, can this have an effect on your baby? So you need to ask this question to your doctor. If you're sick and you're being treated in a certain facility, make sure you ask your doctor this particular question, because of this concern of some drugs being excreted through the breast milk. Kindly remember to ask your doctor this question. Another question: how much should a newborn be feeding every day? How much should a newborn be feeding every single day? So again, this depends on an individual baby. Some babies have such huge appetites, others have average appetites, others have little appetite. So I would say be led by the baby. If the baby wants to feed this baby as much as he or she wants. So this is called on demand breastfeeding. So feed this baby on demand. Let him feed as much as he wants, and you know that they are full if they can if you're able to change at least 6 to 8 diapers, and those are the things that I told you. So how much should be baby led, that is on demand, feed the baby on demand. So to wrap this up, I suggest to take this breastfeeding class. I cannot emphasize this enough. There's a link below this video. Kindly take this breastfeeding class. It's very informative, and it will open your mind, and as well as equip you much better, because this experience is not easy, even though it's natural. So my name is Nasteri. Thank you so much, and I'll see you in my next video. Remember to subscribe, share, and like this video. God bless.